Hello, my name's Dr Vicky Cleak and I'm a consultant psychiatrist with a special interest in adult ADHD. And today we're going to be talking about ADHD and the impact of that on your work. As always, these videos are intended to be used alongside my free to download A Woman's Guide to ADHD Mastery, Finding Out Who You Are Without ADHD. You can find this at my website, drvickycleak.co.uk. So here we go. Buckle up. So what do we know about people with ADHD and how they perform at work and difficulties compared with people who don't have ADHD? Well, there is lots of research around this subject. What we do know is that those with ADHD often have lower occupational status overall, and we'll go into why that might be later on. They have lower work performance, higher rates of sickness absence, an increased risk of workplace accidents. They also don't earn as much over their lifetime, and that is often because they move jobs frequently, and that also leads to what we call sort of checkered employment history. A WHO study across 10 countries showed that those with ADHD had 8.4 times more sickness days per year compared with those without ADHD. And in another study, after controlling for substance abuse and mood disorders, stimulant use in childhood was actually the strongest predictor of being in work in adulthood. So if you identify ADHD early on and you treat it effectively, then this has long-term impact both on your education, but also in terms of your work and work history. So let's go back to what the core features of ADHD are. There's the impulsivity, the impatience, poor working memory, having impulsivity, forgetfulness, procrastination, poor regulation of attention, a different sense of time. Often time is underestimated, how long things are going to be, and poor emotional regulation. And we'll go through how each of these core features can impact on your work life. So in terms of impulsivity, obviously if you tend to speak and act without thinking, that can lead to numerous problems in the workplace, such as quitting your job out of the blue, and I've seen that on many occasions with patients I see in clinic, sending emails without checking that they are accurate, that the spelling's correct, also sending them impulsively when you haven't really thought through how that email is going to be perceived by others, so without thinking through the consequences. Talking over others, interrupting others in meetings, which for people with ADHD is just something they can't stop doing. And again, in clinic I see patients who, when you give them stimulant medication, suddenly they can not do that. They can have the thoughts in their head and they don't come out of their mouth. Rash choices, you know, if you're having a bad day at work and you get a pop-up of another job application, that can make you impulsively, without thinking through all the consequences of that, apply for a different job, move jobs. And also being quick to react to others. And what about impatience? Well, we know that people with ADHD, particularly those with sort of hyperactivity, are often very impatient. They can't wait. Waiting for things makes them feel cross and frustrated, leading to irritability. It can also lead them to give up waiting for any response at all. That can be in terms of waiting for emails. That can lead to them making decisions without waiting for other people's input, which can cause upset with other people you work with. Those with ADHD can be quite intrusive to others in terms of interrupting them when they're in the middle of a phone call or a piece of work. And there can be that problem with impatience with slow progress or change. So if someone with ADHD, who often thinks outside the box, can see something in the workplace that could be done better, they will want to change it. But if the workplace they are working in is a slow moving, very bureaucratic place, such as the NHS, in my situation, they can get very frustrated at that slow pace of change, and that can lead them to give up and step outside of that workforce and go and work somewhere else. What about the impact of a weak working memory? Well, that means that a person with ADHD often has difficulty holding onto ideas, multiple ideas in their head at the same time, and that leads to them appearing to be forgetful. They can't cope with interruptions. They might ask for information to be given to them repetitively. That can be perceived as slowing them down in the role, and even into paralysis. So when a person with ADHD is given too many things to do at the same time, it can literally lead to a kind of shutdown, a paralysis, and they don't know where to start. They just feel overwhelmed, because people with ADHD, when they're given a list of tasks, find it really difficult to prioritise them, and they all need to be, in that person's mind, done immediately, and help with that can really make a difference. What about the impact of forgetfulness? Again, I think forgetfulness is really related to two core features of ADHD in terms of poor attention. So if you haven't got the attention and your mind's on lots of different things, you don't take in the information, you don't put it into your long-term memory. If you haven't written it down somewhere, then that can be a really struggle for the person to actually remember what they're doing. Those that I see in clinic who have difficulties at work, those difficulties we've discussed can lead to an increase of anxiety, and depending on personality and experience, a person can go one of two ways. They can either end up double and triple checking things, over organising to try and cope with their forgetfulness, doing a task twice and forgetting that they've done it the first time, but also it can lead to them just sort of giving up entirely. It's quite common for those with ADHD to double book appointments and meetings, to miss opportunities, not having the correct equipment, which can be a problem at school as well. Problems remembering your IT password, particularly after a holiday, and that can really slow a person down if they've got to then contact somebody else to help them with that. That happens in the NHS all the time. And needing information or lessons repeating. I think people with ADHD often find that doing a task helps them to remember, rather than just hearing or seeing on paper what needs to be done. They actually need to do it to put it into their physical memory. So I mentioned already about people with ADHD having poor ability to prioritize, because they feel overwhelmed by everything feels like, all the tasks they have feel like they need to be done immediately, and that can present, as I said, with either them giving up, or really overdoing the strategies to not forget, which can slow the person down. So that sort of flight, fight, freeze response of sort of panic can present. There's often a sign that someone has ADHD when they've got multiple, really scary amount of tabs open on their computer, that they have really never organised their emails, so they can't find anything that other people seem to be able to find immediately. They struggle with organising their paperwork, and often it'll be there, but it will be in piles that are not really properly organised in a way that somebody without ADHD would do so. One of the other core features with ADHD is procrastination, putting things off to the last minute, and that's because there is a reduced dopamine level, which rises when tasks that are more important or stressful get to their end point. That level of dopamine rises and rises until suddenly they're able to act on it. So what that means, however, is that they will put off applications for new jobs or deadlines until the very last day, and if then that piece of work is too much to do in a day, it won't get done. One of the strategies that can be really helpful is chopping longer pieces of work into shorter amounts with more frequent deadlines and touchstones, so that if a person does leave it to last minute, they are actually able to do it in that shorter amount of time. So patients with ADHD tend to focus on the urgent and the immediate rather than the important and the non-urgent. So people with ADHD often get very enthusiastic short term for things that are new, novel, exciting, but that can be very short-lived. And so when a person with ADHD starts a new job, it can be very exciting and shiny, but when the interest wanes off or the frustrations increase, that can lead to them moving sideways or stepping out of that career and starting a new job. And so as a result, those people with ADHD often don't progress, and they often then don't earn as much as those people who have stayed in a job and have progressed up the ladder. So people with ADHD are often jacks of all trade but master of none, and as I said, that has an impact on your finances, both in the moment but also in terms of pension and savings long term. The other impact it has is in terms of relationships. And of course, relationships are what give people connection, happiness and support. And if you're moving from job to job, you never really develop those connections that are deep rooted. And so you may lack support, may feel lonely. People with ADHD, once they move on from a job, often find it really, really difficult to stay in touch with their ex-work colleagues. And this is despite big intentions to keep in touch. Out of sight is often out of mind with those with ADHD. What about the impact of weak attention, poor attention regulation? Well, if you're more easily distracted, you can't pay attention, you're more easily distracted by things externally, but also internal thoughts, then a task is going to take you longer. It's often going to be done with errors. There's a reduced efficiency. Alternatively though, when somebody with ADHD is very, very interested in one thing particular, they may also hyperfocus. And that can be really productive as long as that hyperfocus is on the correct thing and in the right direction. I've already mentioned that those people with ADHD have a very different sense of time to those without ADHD, and that can lead to turning up to work late, even when they have seemingly got up in time because they've been distracted by other tasks on the way, like putting the washing on or just beginning to make dinner before you go out to work. People with ADHD often really significantly underestimate how long a task will take, and so one thing that can be really helpful is to help them consider and think about how long is that task going to take, measuring how long a task is going to take, so they kind of learn that. That underestimation of how long a task is going to take can inevitably lead to overscheduling, so taking on more tasks, particularly if they sound shiny and interesting, and thus, becoming more easily overwhelmed because all the tasks will seem to be just as important, and as we've mentioned before, in terms of that poor ability to prioritise. And that of course all leads to an increased risk of burnout. And I've seen time and time again patients who are in work who go through cycles of several weeks where they are super motivated, they do too much, they then get quite tired and fatigued and irritable and don't care as much in this kind of burnout cycles. It's really, really quite common. So although it's not an ICD-10 or DSM-4 criteria for ADHD, I think it's going to come eventually, because those people who work with patients with ADHD really are aware that ADHD is associated strongly with having emotional dysregulation. People with ADHD, not always, but are often seen as mercurial or passionate. They wear their hearts on their sleeve, and it's really obvious to those around them what mood they're in, and that can have a really big impact on your workmates and productivity of a team if you're at the head of a team. I've also seen patients who manage their emotional regulation by shutting down. So just not interacting with anyone at all in case they will come across as emotional. And, you know, that obviously impacts their relationships and how they're seen in work as well. And very frequently, those people with ADHD that's really interfering with their work end up with quite poor self-esteem and a significant amount of shame. So all of these core features of ADHD that we've just outlined and thought about can either be masked, reduced or managed, or magnified depending on support structures around you, the type of work you're doing and your level of interest in it, and also your personality. Things that will help reduce the impact of ADHD, and in fact may lead to it not being a problem, include things such as having administrative support for those tasks that are, you know, more difficult for those with ADHD, having more family support at home, having a good work-life balance, having a type of job that you are motivated and passionate about, with that is not repetitive and perhaps involves movement. But as I've said, your ADHD difficulties may be magnified if you lose admin support. Changes in IT or other scaffolding can really cause problems for those with ADHD. And of course, for women, being premenstrual, postnatal or perimenopausal will have significant impact on the work environment and how they are coping at work, because as we know, all of those times in a woman's life will lead to an escalation in ADHD symptoms. And you know, if you're not aware of that, that can be difficult for you as an employer and for you as an employee. You really need to consider whether your job works for someone with ADHD, because if it doesn't, it's never going to work for you, ever. And you know, you're essentially asking, you know, a fish to function on land, to walk on land. And a fish is never going to walk on land. But if you put a fish in water, although this fish is in the wrong direction, you're going to be much more functional in that environment compared with you know, somebody who's got two legs. So it's about finding the right work environment that fits with your strengths and that doesn't magnify your difficulties. So jobs that do work better for ADHD are those that have got this element of change or unpredictability, that have quite high adrenaline. So in medicine, which is, you know, I'm a doctor, so I know more about that. Often you find people with ADHD in roles such as around A&E. If they're in psychiatry, they might do liaison psychiatry or acute psychiatry, rather than working in a forensic setting where you get the same patients for years and years and years. If you're 100% in love with what you do and it fits with your core beliefs and who you are and what you're passionate about, then you're going to do much better with ADHD. A role where movement is allowed or encouraged is also a job that's going to work better, and one where being creative, thinking outside the box is valued, is also going to work for you. Jobs that don't work well for those with ADHD are those where there's significant amount of repetition, where there is a lack of administrative support, where there's lots of detail, where there is a need for linear working and conformity, where creativity and alternative ideas are not valued or are suppressed, where there's no sense of deadline or accountability, and where there are significant distractions. So working in an open office or hot desking, that's going to be very difficult for somebody who's got ADHD. So ADHD is under the 2010 Equality Act and employment law is defined as a disability, and as such employers have a statutory duty to make reasonable adjustments for you to function well at work. So it is worth telling your employer that you've got ADHD and asking perhaps for occupational health referral, or getting support from your clinician that you see with ADHD, so that your work can understand what helpful adjustments, and sometimes that will make a difference. And sometimes those helpful adjustments are not particularly, don't come with money attached to them. They can be quite simple, such as ensuring that any instructions are written down, given visually, that there are perhaps incentives, that IT systems are without barrier and are easy to navigate, and you're given support in how to learn and shown how to learn all the systems when you start work. Mentoring can be really helpful to help you prioritize and also to keep you accountable to deadlines. And regular meetings with your supervisor can really help with that. So ACAS have some really good information, and there's a website address for that. They've got some really useful documentation about what strategies can be really helpful for those with all sorts of neurodiversity. So in summary, ADHD, which is a very pervasive, long-term, chronic set of difficulties, will significantly have an impact on the work environment, and the impact is potentially quite significant. And you may not until now have really reflected on how your ADHD has affected your work experience and your employment history, and hopefully this will help you do that. In terms of personal reflections, how has ADHD affected your choice of career? Did you try something that didn't fit, but you didn't really understand why it didn't fit, and then have found something that does fit, and now perhaps you have more insight as to why that is the case? How has ADHD affected your career direction and progress? Some of the people I see in clinic have had, several careers. They've started, including, paying significant amounts of money for training and significant amount of resources put into that, and then have not really stuck with it, even though they were quite capable of the job at the time. They lost interest in it, for example. What aspects of your work life or personality have mitigated against the effects of ADHD at work? So have you had a work colleague or admin support that's really significantly helped you? Or are you quite a diligent person and don't like making mistakes, and as a result of that have put a lot of strategies in place, which in itself can be quite stressful to keep up, but strategies in place to ensure that your ADHD is mitigated against? Or has your ADHD made your work life harder to manage, and in what way has that been the case? And from this discussion, what new ideas do you have that perhaps will make your work life better or easier? And now's the time to look at your Women's Guide to ADHD Mastery and complete the self-reflection part on your work experiences, as well as fill out your ADHD timeline with any particular milestones that were significant in your work life which were related to ADHD. Many thanks for watching this video. I hope you found it useful to think about the impact of ADHD on work, and I look forward to meeting you at the next video. Take care. on